Old people had dreams of having their own nurses and doctors, and their own people started working here, and that was really something.
We are northwestern British Columbia, north of Prince Rupert, BC, and we've lived here for a very long time.
So Nisga'a Valley Health, part of its mandate is to provide care in each of its 4 communities of Nisga'a Nation, so Gitlac-Damix, Gitwin-Silk, Lac-Altsap, and Kincolith. And so in each of the communities we have a health center that is staffed by nurses, and in recent years we've been able to recruit enough physicians so that there are physicians in the health centers each day. A lot of the work at Nisga'a Valley Health has been done to try to bring services closer to home. I believe that everyone in British Columbia should have access to quality health care.
I think being able to access care on your own territory is huge for the community here. And not just accessing healthcare, but being able to access healthcare that makes sense to who you are as a person. So that's a big part of the work that we're trying to do with the Health Authority here now is really integrate Nisga'a traditions, Nisga'a language, Nisga'a culture into the work that we're doing, and that's a big step that we're starting to take now and doing some community work, consultations, working with community members, elders to get that information and try and integrate that into our work better, because I think that's a huge part of making sure that care is not just safe, but care is relevant and appropriate and makes sense for people here.
In my life, I've heard from family members that, well, why should I go to the doctor? They don't hear me. They don't believe me. And all they want to do is prescribe me more medication. The number of people that we have at our health centers that are Indigenous, it's really encouraging, because more young people that walk into our clinics helping their elders in, they see people that look like them. And for them, that gives them hope that they're going to be heard the way that they need to be heard to receive the care that they need.
I work for Nisga'a Valley Health Authority. It's a new role for me, and it's a traditional wellness coordinator. And what we do is try to enhance the traditional teachings of our ancestors, our forefathers and our foremothers. We're another entity, the mental health department, that they can utilize if they have a client that maybe might need a little bit more help. Bringing them out onto the land and bringing them out on our waters is therapy for anybody, no matter who you are.
So a win for us would be that we provide care to our patients that makes them feel heard, appreciated, safe, and that they go home healthy at the end of the day. And I think we are so lucky to have a team that all cohesively feels that that's important.
One of the things that we often think about if we are improving and having good outcomes with all the services we provide is that we might have less visits in the health center. But we actually have more visits, and I actually feel like that's actually a good thing. We see people a lot more because I feel like they're more comfortable coming to us.
It's a good thing when we're responding to the needs of the citizens and hearing them. And that's what I would offer to other nations that would like this support. And in the end, it's a healthier option for our citizens to hear them, to respect them, and to do what you can to provide the support when they need it most.
We're open to sharing with other nations. They're basically our brothers and sisters from a different nation. So we understand that they have all the same issues that we have, and we'd love to share. We're definitely open for collaboration.
As a community member, it's really gratifying to see the commitment that is there for those that support the work of health. We have some champions of health, and it's a good feeling to know that we have some leaders that are supporting the good work that's happening.
Most of the people in the NAS will call it the end of the road because it was the last community that was connected via the Nisga'a Highway. But our people in Gengoich call it the beginning because it's where the ocean meets the river.
Do the good work that you're doing. Keep on doing the good work that you do. Saam wilse misqanism luihalal sedal tumwi amawil ptgon. Saam wilse yuktab bdaqal sakskum gandedils al qaltiptap wiltaqamsa.